Uh, Good morning, everyone, and welcome to the Master of Public Health webinar this morning. We'll be talking about how you can develop your career with the Master of Public Health. Join with me this morning is Academic Lead Alan Whitfield, who is the Academic Lead on this course. So I'm just going to introduce you to the University of Derby Online Learning. So give you a bit more information about us. So we are a division of the University of Derby, and we have been providing online learning for over 13 years. So we have a wealth of experience in not only teaching online, but our tutors and our academics are all experts in their fields and their subject areas, as well as online learners. So we're very vocationally orientated. So we have a wealth of accredited programs in Utah, and throughout the course receive non-academic support from our team of online learning advisors. So not only do you get support all the way through from your tutors, your academics, but you also receive academic support from whether it's about fees, finance, payment plans, modules, from our learning advisors. So why study with us? So we offer structured and supported learning with our dedicated online tutors. So as mentioned before, you're taught by academics who are experts in their field of study. So Alan, who will speak to you in a little bit, will also tell you about his experience in environmental health, public health, and all his everywhere that he's worked. So we're very, in terms of online learning, innovative. We like to have a lot of interactive classrooms, discussion boards, webinars, blogs, email and Skype. So these are also a way to talk to your fellow students, talk to your tutors, get discussions going, feedback. So it's a great way to ask questions and to share best practice as well. So you can study any time of the day, anywhere in the world. So whether you want to study in the evening or in the morning or in your lunch break at work, everything's available to you 24 hours a day, 7 days a week. So it's easily accessible. Everything is online. You also get a range of kind of like an extensive e-library. So you get all the facilities online. You also get help on digital tools, on academic support in terms of writing reports to presentations, but our extensive e-library is a great facility. You can choose from 3 different intakes for our online learning. So you can either start in January, May, or September. So it's very flexible in terms of when you are looking to study. You will also achieve a recognised British University Award. Your award will actually be from the University of Derby, and on your certificate it will not state that you studied online, as you are part of the University of Derby. So some of the benefits, I've touched on some of these previously. So you can develop contacts and friends all around the world, so it's a great way to network as well. So especially when you have a whole cohort of global alumni, you can create professional links. Studying for a degree, not only just online, can enhance your career prospects and employability, and it's a great way, online learning, to fit your studies in around your work and personal commitments. So whether you've got your family or you've got other personal commitments through to your work, it's very flexible in terms of when you're looking to study. The best thing about online learning is that you can actually apply the knowledge and skills you learn throughout the course directly into the workplace, so you can practice as you go and further implement your knowledge. So again, as touched on, you will have a UK University Award with no distinction that you studied online. So how will you learn? So you can access this portal, the student portal, where all your learning materials will be, through the student login on our University of Derby Online Learning website. And this is what the portal looks like. So you have access here to your email, your library, your grades, your calendar, your passwords, all the programs that you may be studying through to modules, and so as well all about your learning and anything you've submitted. And again, this looks a bit more into like a module that you would be taking. So you can see all the units that you have here, and then you can go in here and go into the discussion forums as well. So this is your central hub for all your learning materials. So I'm just going to pass over now to Alan, who will be able to take you through the Master of Public Health course and tell you a bit more about himself and about the course. Over to you, Alan.
Thanks very much, Natalie. That was really useful. Thanks for that. So what I'm hoping to do in the next few slides is to just go through the Masters of Public Health. So I'll give you a sort of an introduction to the tutors that we currently have working on the program. I'll do a very brief overview of the program itself and the modules that you're going to be studying as a part of it, and the subject areas that you're going to cover. And then I'll talk a little bit about the resources that we have and what you can expect from us and from your tutors. So the excuse me, the public health program, this Masters of Public Health, it's been set up to give you a thorough critical understanding of the multifaceted discipline of public health. So we try to cover the whole breadth of it. And we're looking at the issues that are currently impacting on the health and well-being of individuals and society as a whole. So we're very much looking at the communities where people are and the things that impact on their day-to-day health and well-being. So that could be in the workplace, it can be where they live, it can be the environment around them, it can be their access to education, their access to health facilities, all those sorts of things that we'll be exploring with you as a part of the program. So in terms of the program team, there's myself, who you'll see sort of midway down the list there, but the actual academic lead for the program is Gillian Carlton Boylan, and so she was the main sort of point of contact. She can't unfortunately be with us today because she's actually teaching on the MPH that we're running on campus at the moment. So we already run a fairly successful MPH program on campus. And what we've been doing this last year is we're developing it so that we can actually deliver it online, because we think that having a more flexible approach gives us the ability to offer it to a wider range of people, not just across the UK but across the world. The on-campus MPH does attract quite a number of international students as well, so it's a really sort of good thing. And they do study some of the modules online as well, so it gives them some flexibility once they're on campus. Gillian is like myself, is a qualified environmental health practitioner, and we have both worked in environmental health over the years. I've got slightly few more years on it than Gillian, but don't hold it against me, I suppose. And I've certainly worked in Southeast Asia as well. I worked out there for a few years in environmental health. So I've got first-hand experiences of some of the global issues that are facing that particular region. And the other on-campus member of the team is Bruce Burkett. Bruce is a housing and health expert, and so you'll come across Bruce on some of the modules, particularly where we're looking at the housing impact on people's health and well-being. But as well as the on-campus team, we also employ a large number of what we call associate academics. That's the AA that you can perhaps see on next to some of the names here. And what this means is it allows us to get the best people that we can to deliver the talk content. So we've got some real sort of experts in their subject fields helping to deliver some of the modules for us, and they bring their own personal experience. So whilst they're employees of the university, the vast majority of our associate academics are actually working in the public health field in one area or another, and so they bring that added dimension. So their experience and their knowledge is very helpful in sort of in the writing of the course materials, doing the various case studies that we use as well. So we've currently got about 5 core members of our associate academic team, and we are looking to expand that as well and get some other experts in as well. The final name on that list, Michelle Humphreys, she's actually our designated online learning advisor, and I know Natalie's already mentioned this. So as well as the academic support that the course team will give you, there's also Michelle available to help you with the other more administrative matters as well, and to guide you through any processes as needs be. So the program itself that we deliver for you, it's got very much a practitioner focus. So what we're trying to do is to equip people with the skills and knowledge that allow them to go out and actually practice in public health, and that's at a community level. So we're very interested in actually making sure that people can go out and they can almost hit the road running, so to speak, and that allows them to actually practice in communities. And that's not just working within the United Kingdom. That could be equally applicable to any country around the world, because real health benefits actually occur at the local community level. That's where we need to be looking. That's what we need to be targeting. The program, in terms of the content that we deliver, we've mapped the content and the syllabus to a thing called it's the United Kingdom Public Health Register. Those of you who work in public health in the United Kingdom already, you'll be familiar with this, and it gives us a guidelines as to the skills and the knowledge base that a public health practitioner is expected to have within this country. And those skills are transferable to anywhere in the world. And so the MPH, if you like, is a brand, and it's recognised around the world for what it is. I've already mentioned that we're very practitioner focused, so it's about giving you the skills and the ability to actually go out and implement health improvement strategies and such like, and to evaluate them and so on. The content that is obviously is relevant and it's very topical, and it's a fast changing area at the moment. Certainly in the United Kingdom, it's moving at a real pace at the moment, and there's quite a lot of initiatives coming down from central government and the such like that we're looking to sort of to incorporate into the program. But we also give the program an international context, so quite a number of the modules will consider the international and global aspects, and we do have some dedicated modules which actually do look at the global issues in public health, and there are some slightly different priorities in different countries, and we do look at some of these as well. And in terms of what do you do when you finish with it? Well, you get your MPH, which, as I say, is a recognised degree around the world globally. And it is good for career development in both the public sector. So if you decide to go and work, within a health authority, or for Public Health England, for example, in the United Kingdom, or the local authorities, which is where most of the public health work is now done in England. It's actually done at a local authority level. But it also gives you the ability to go and work in the private sector. I mean, a lot of the some of the big health issues in this country do relate to the workplace, for example, and so conscientious employers are now looking to employ people to help promote the health and well-being of their staff, and they see that as a way of committing themselves to their health and well-being. So if you've got a happy, healthy staff, then you've got a productive staff, and that can only be good for the benefit of the company in the long run. So there are private sector employers as well who look for public health expertise as well. So that's the team and the sorts of things that we cover. In terms of the actual sort of structure of the program, we are currently sort of looking at this, and we are reviewing this, because we're looking to restructure the on-campus face-to-face delivery, and so at the same time we're going to take the opportunity to also mirror that with the online offer as well. But currently, the program is made up of two core modules, which is what we call Essential Public Health and Epidemiology and Statistics. The Essential Public Health module is the first module that you will study regardless of when you start. So Natalie's already mentioned that we have a September intake, a January intake, and a May intake, so you can start at 3 different points throughout the year, and you will always start with Essential Public Health. That gives you the underpinning knowledge and skills that you need, that you can then take forward into some of the more slightly specialist modules that you then carry on to look at. Epidemiology and statistics, well, I guess it is sort of the name's in the title, isn't it? It does what it says on the tin, literally. So this is where we obviously look at different techniques in terms of epidemiology and statistics, and how you can actually show whether there's cause effects in terms of certain diseases and things like that. In terms of the optional modules, you then choose 4 options, and we're And we're currently offering 5 options at the moment, but you just choose 4 at the moment. We are looking to expand the options when we go forward with the new developments that are taking place over this year. But we currently offer health promotion and behaviour change, which is a psychology-based module. So you'll be taught by health psychologists who are experts in their field and actually carry out research in this particular area, and that's quite a popular module because it equips you with the skills to actually go into communities and actually find out, well, how can we change people's behaviour for the better. There's another module, health leadership assessment and inequalities. So this is very much about equipping you with the skills needed to lead in terms of public health and to actually deal with things around health inequalities and so forth. Health economics and health information is quite a specialist thing, and it's quite attractive to people working in the United Kingdom because the whole finance and funding system of the NHS is extremely complex, and so by going through this module, it'll give you a much better insight into the ways in which it works. The global environmental health and public health issues module is an international based one. This is where we look at public health globally. So we're looking at all the major issues that are happening around the world and in different countries. You tend to find that in the developing countries that the issues are not dissimilar to in the developed countries, they're not dissimilar to the United Kingdom and Europe, but where we have some really interesting challenges are obviously in the more developing countries, and so we have quite a focus on looking at diseases that are affecting these places, but also things like the impact of migration, the impact of natural disasters and man-made disasters like war and such like on the health of the population. The final optional module is health protection and intervention strategies. So this is very much about looking at the sort of the things that can be done to actually protect people's health, and this is quite an environmentally based one. So you'll be looking at food safety, housing, occupational health and safety, pollution and the impacts on that. Pollution is very topical at the moment. I mean, it's the biggest killer of children under the age of 3 around the world at the moment, so it's getting lots of bad press at the moment. So you actually study 6 taught modules. Most people do that over a 2-year period, but it is possible to accelerate that to do it over a 1-year period, and you do that by studying 2 modules per semester. If you follow the normal route, which is basically 1 module per semester. And then the final year, which could be the 3rd year or the 2nd year, depending on how you structure your studies, you go on to do what we call the independent scholarly activity. This is your dissertation. So this is where you actually have the opportunity to have a very in-depth study of a particular aspect of public health that you're interested in. So that's the overall shape of the programme as it stands at the moment. In terms of what you can expect from us, the course team, each module that you study has a dedicated tutor, and if we have large numbers on the module, then there'll be a number of tutors as well, and that tutor will access the module at least 5 times a week to monitor people's engagement with the course resources, to answer any queries that you may have, to facilitate discussion activities and such like. The discussion boards is where we do a lot of the interaction between tutors and yourselves, but also between yourselves and your peers that are on the programme as well. And it's where we get a lot of really good, interesting debate taking place around different aspects of public health. In addition to those sorts of activities, we also run a number of what we call live classroom sessions as well. Typically, you'll get 2 or 3 per module. It's usually 3. There's usually an introductory one, and then we have another 2, which are usually linked into the different coursework assessments that we do. And we use the Blackboard Collaborate to deliver that. So that's this sort of form that we're using at the moment. This is Blackboard Collaborate. And it gives you the opportunity to actually ask in-person questions of the tutor, and to take part in any discussions that might be going on with your peers as well. As you work your way through the various course resources, we do have a number of what we call formative activities. Formative activities are about you developing your skills and knowledge, and building up to the point at which you'll be able to then submit what we call the summative assignment. So the formative isn't formally marked as such, but you will be given feedback to help you develop your learning. So typically at the end of every week, we have an end of unit activity, and this this gives you a specific activity to engage with. So it might be that we ask you to read a current paper from the literature about a particular topic, and then to just produce a brief summary of what you think that the main findings are. And you then share that with your peers, and you can we then enter into some discussion with your peers about how important this is, or was it a good paper, was it a bad paper, that sort of thing. At the very, the other thing I've mentioned at the bottom there is quite important, and it can be a bit off-putting to people. We do study quite a lot of epidemiology and statistics as a part of the program, but don't be put off if you're not too mathematically able. There is a lot of support, and we approach it in a very applied way. So rather than just going through different statistical tests with you, we will actually utilize real life data so that you can actually see how it's used in the real world. It's not just a case of just going through different types of statistical tests and epidemiological study approaches. It's actually about how we actually apply it in the real world, which is what a practitioner needs at the end of the day. So in terms of your interaction, it's an online program, but you need to be aware that you are not alone. Isn't that what they say about space, isn't it? You are not alone, or we are not alone. Yeah, that's what the name of the film was now. Anyway, it'll come to me later. That's really, really important. So you will have opportunities to talk and to communicate with your peers. Okay. And this is facilitated through what we have, the discussion boards. We also get you to keep personal development portfolios. There are the live sessions that I've mentioned. That you can have one-to-one contact with your tutor by email. We can use the telephone, obviously. We make a lot of use of Skype. We find Skype actually works quite well, particularly with international students. And you will have 24-hour access to IT support as well. So if you find that somebody's not quite working for you in terms of the computer you're using or the software or whatever, the IT team are there to help you. And it's quite important that it's 24-hour access, because obviously somebody the other side of the world in Hong Kong or wherever, there's a different time zone, and so when they might be studying is when typically we might be in bed. So it's quite important that we have that 24-hour access. Most of the tutors, we try to get back to any specific queries that you may have within 48 hours. Because sometimes that can take a little bit longer, but there will be an out of office thing which informs you about our movements and such like. In terms of sort of reading lists and library resources, we're very fortunate at Derby that we've been delivering environmental health and public health over the last 15 years online, and so we've been able to actually build up quite a comprehensive online library of resources. So we've got lots of online books, we've got access to lots of online journals, but we've also got access to lots of technical databases as well that we make use of. And that can be quite invaluable in terms of researching topics and such like. So we're very fortunate that we do actually have a very extensive sort of library. If you do live in the United Kingdom and you're in another city which has got a university, it's also possible to have reciprocal arrangements with those libraries as well. and that can be facilitated through our library as well. So we are quite fortunate with our library resources. So next term starts on the Tuesday the 30th of May. So it's about what, 6 weeks away, something like that, 6 or 7 weeks away. So that's when we next start teaching. So if you're thinking of applying for the program, then we welcome your application. We'll be pleased to receive it. Get it into us, and we will get it processed. We've got a dedicated admissions team of advisors who can guide you through the process if you have any problems. If you've already applied and you've been accepted onto the program, then the next stage for you is enrolment, and I think that opens in the next few weeks. But you will be contacted by the admissions team, and they will tell you. And once you've enrolled onto the program, you'll then have access to the student portal that Natalie showed you images of before. So it is actually worth enrolling perhaps a week or so before, at least a week or so before the start date, because you can then go into the learning environment and you can navigate your way around it. You can have a look at what's there and just get used to the feel of it, because it will be a bit strange at first, and there are things in there that you'll need to get used to. But so the earlier you can get into it, the better. So what we always say is that try and enroll promptly. Once you are enrolled and you can log into the modules that you're signed up to, read the guides thoroughly. There are module guides for all of them. Look at those, look at the assessments, and then you can start to prepare and to plan for your study over that 10-week period, because it is quite an intensive period, that 10 weeks when you're doing the studies. Check your email account regularly. When you do enroll, you'll be given a uni-mail account. It's a university email account, and that becomes your default account unless you change the settings. So if you do really want to get your emails sent to a different account, one that you use more easily on your phone or whatever, you'll need to set it up and to change it so that everything gets forwarded onto that account if you wish to, because we always use the default settings when we try to contact you. So check your emails regularly, and also check for announcements. You will get notifications emailed to you every time we put an announcement up. So that's both at a program level and at a modular level as well. So you will get notifications coming through when announcements are made and the such like. A lot of the learning takes part in these group discussions, and so it really is important to try and engage with these as much as possible. The tutor is there to facilitate it. There are activities for you to take part in, and the more you sort of get into that, then the more you'll benefit from the learning experience, and the more that the wider you'll expand your knowledge on that. Any problems, contact us. Don't hang around or wait or put it off. Just get in touch. We don't mind. It's what we're here for. Academic stuff, come to the tutors and the program lead. More administrative type things, go to the online learning advisor, and she'll be able to help you. But if you're not sure, get in touch with one of us, and if we don't know the answer, we usually know someone who does, and we'll sort you out and put you in touch with the right people. So, any questions at the moment? I suspect not.
Adam, we are recording the webinar session, so we will send it out so you can touch base and go back over it and kind of revisit anything that you might have missed. So we are available on our online admissions at derby.ac.uk website, account, email even, so you can contact us there, and on our phone number as well on the website. So please don't hesitate to get in touch as well. So I'll wrap up the session then. Thank you everyone for joining us this morning, and again, keep in touch. So if you've got any questions or any queries, or just want to follow us on our social medias, please do. So thank you everyone for joining us.
Yeah, thank you all very much, and look forward to meeting you on the program. Thank you.
Right,
Bye.
thank you.